Welcome everyone to this afternoon's presentation. I am so pleased that you're here. We're guessing that other people might be wandering in, and April Ballard from the Center for Global Health has been so kind as to go outside and be sure that people aren't wondering about which door might be the entrance to this spot. This feels like the reverse of no exit to me when we try to come over here and think where we should be. This presentation was given once before, very soon after our speakers returned from Haiti prior to spring break, and we did have a number of people there. We were hoping to gather students, and we did. So we decided to reschedule it, and this time it's being recorded. Am I correct about that? So that into the future, faculty members who were not able to come this time and others will be able to access the presentation. But without further ado, I'm wanting just to mention to those of you who are interested that tomorrow we have another international forum on quite a different topic, which is actually a research collaboration between one of our nursing faculty and her colleagues in Israel. I hope very much that some of you can make time for that. And today we have the pleasure of having Audrey Snyder, who is on our nursing faculty, who has, some people say she's the queen of disaster, and I think we're going to have to figure out a different way to refer to Audrey's incredible work both in disaster relief, but also in bringing health care to remote and rural and remote areas, people with very little access, and thinking about the kinds of conditions that they challenge us with as we learn to know them. Audrey, if you would come forward, I would ask you to introduce your colleagues and take the presentation from here.
Thank you, Dr. Greiner. So there are a couple of us here today who've had the opportunity to serve in Haiti, and we're going to do a little bit of a reverse from the last presentation and let the group that presented last present first. So I'd like to introduce Dr. Sara Sutherland, who is a member of the emergency medicine faculty, and along with her, Kathy Butler. And then John French was the third member of their team from UVA, and then Dr. Scott Syverud and I had the opportunity to work together in Jacmel, Haiti. And we'll let Sara start off with the presentation, and then I'll come back and share about our experiences.
Okay, hello everyone. As she said, my name is Sara Sutherland. I'm an emergency physician here. And I was fortunate enough to be able to go to Haiti along with Operation Smile, who headed down to Haiti with a mission a little bit different than their normal mission, which is cleft palate work all over the world. And instead, they used their organizational abilities to assist a hospital that is providing orthopedic and rehab care in Haiti. This hospital, I guess my mouse isn't working. If you look on the map, you can see that there are two rather large lakes at the Dominican and Haiti border. And where we were was right up against the lake that you can see right on the border there. For whatever reason, the mouse is not mousing, which is fine. We came into the Dominican Republic because when our mission started, the airport was not quite ready in Haiti, and that was a long 5-hour drive along bumpy roads. Again, it was really nice to be with Operation Smile because they knew the process, and if you look at the border, it was very chaotic. There were multiple buses there with lots of other groups trying to get into Haiti, waiting for hours and hours, and somehow we were able to slide through very, very quickly and without much difficulty. We came to our site, which is at a orphanage that was already established there in Parisien, Haiti, called Love a Child. And the groups that were working with the Love a Child orphanage was the Harvard Humanitarian Initiative. They were the main organizational group at our site, as well as the governments of Haiti and the Dominican Republic. John French and I worked initially, our initial role was to manage the PACU. He was the main nurse. I was supposed to take care of any problems that came up. I learned how to start peripheral IVs again, which is not something I do a lot here. The bottom shows sort of a panorama of our PACU. It became very hot as the day went on. It was really like an oven. The temperature by 2 o'clock in the afternoon was usually about 95. If you look at the bottom right, that was our monitoring station. We did find a monitor and some suction, but we didn't really have any tables. Wood is very scarce in Haiti, and so we found some random boxes to support our monitor station. To be able to figure out what to do in the camp, there were maps that sort of showed where the tents were. The tents were broken up into the type of patients. Rows 1 and 2 were primarily pediatric, and then we had quite a few rows that were with people who had X-fixes, and then some that had some pretty bad wounds. One of the things that we really discovered, and the orthopedists discovered with these X-fixes, it seems like when the people were crushed and they got them done, I'm not convinced that the initial X-fixes were put on with the benefit of radiology, because the fractures that we were seeing had no hope of ever healing. The bones were so far apart, and it was one of the things that the orthopedist really struggled with, was that here these people are five weeks post-injury, you know, everything's starting to heal, but it's not healing in a way that can result in anything good, and so the surgeries were very difficult. On Sundays, there was a church service that would go pretty much the entire day, and despite, you know, the fact that these people were all suffering or had suffered, they were able to just sort of sit back and rejoice throughout the whole day. It made the Sundays much more pleasant in the camp, because this music was nonstop, and it really was a lot of fun. This is our wonderful hotel that we stayed in. It was we had a wonderful view over towards, if you look sort of the white in the distance, there are the limestone cliffs that are at the border of the Dominican Republic. So we were really very close to the Dominican Republic. Our bathrooms were sort of interesting. They were, at least for the first half of the week, co-ed. And you couldn't shower in them because they didn't have enough ability to get rid of the fluid. So our showers were a blue tent not very far from our tents, and you took a bucket and poured it over your head to wash. These were the ORs. As you can see in the front of the one, they'd have a little autoclave. You'd bring the patient in, and it was very, very tight quarters. There was no C-arm. They had air conditioning, but it didn't work very well, so it was very hot. And it was very difficult for these complex orthopedic procedures to take place here. They did have a small ER that people would, you know, they knew that they had doctors here, so people would come, and like any emergency department, it was a little bit busy in the morning. It got completely packed by midday, and at nighttime it was just about empty, so it really sort of felt like home. We had meetings every day to sort of go over what the plan for the day is so that everybody was on the same path, and that was run by the Harvard group. The pharmacy was stocked with pharmaceuticals that were donated from a wide variety of areas. When we first got there, there was a pharmacist who was helping us out and would sort of dole out things, but she left halfway through the week, and at that point, basically, if you took anything, you just wrote it down. There was a NARC box which was locked, and, you know, so people couldn't just walk in and take those, but you sort of had to manage it yourself without a pharmacist.